So if you want to go ahead and give a brief introduction.
Welcome, my name is Dr. Cynthia Hupert. I am faculty member and also the graduate nursing program coordinator at Saginaw Valley State University.
Awesome, thank you. So our first question from students is, how will classes be taught?
So in the graduate program at SVSU, both the master's classes and the DNP, the Doctor of Nursing Practice classes, are taught majority online. The MSN courses do have some where you come and meet face-to-face in specific semesters. So classes like health assessment. And when you get into your clinical courses, you may meet probably once per month. With the DNP program, majority of the classes are online. Actually, all of the classes are online with the exception of one Saturday in the fall semester and one Saturday in the winter semester. You will come to campus for a class on that Saturday.
Thank you for that. So the second question is, how will assignments be posted for both programs? Where can students find all of their assignments?
So assignments for the course specifically will be posted on Canvas by their faculty member. So in the nursing department, we use the platform Canvas, and that is where all announcements and assignments will be posted for students.
Awesome, thank you. And students are also curious about how many credits they should take each semester.
So the number of credits each student will take will depend on their plan of study. So it'll depend on if the student is going part-time or full-time, and if the student needs a specific number of credits for financial aid. All of the courses and the sequencing is determined on admission. When you're admitted into the program, you will receive a plan of study that will list all of the courses you will take each semester for your program.
Awesome, thank you. So in that course of study, then that's how students can find out what classes they should take each semester?
Absolutely. So it's all within that course plan. You can also look on Cardinal Direct that has specific dates the courses may meet if they need to come on campus for that course. And if there's any specific questions related to the plan of study, they can reach out to the graduate advisor, which is myself.
Awesome, thank you. So in your opinion, what do you think is the most difficult aspect of the program?
So, I mean, taking on any graduate education can be very, very challenging. I think given our circumstances right now that we're in, and when you make that commitment to go back to graduate school, I think some of the hardest, most difficult aspects are finding a balance between working, because majority of our students work full-time, and schoolwork, and then personal life balance is one of the most challenging aspects.
Great, thank you. Who would you identify in the program as a resource to students to contact if they have any questions?
So within the program, we have a number of resources that you can contact. First being the graduate coordinator for your plan of study and academic advising. Faculty members of the course are more than happy to help with anything related to their course or any questions that you have. Within the graduate program, we also have an embedded librarian. So if you need help with resources related to maybe literature searches or with the library support, we have an embedded librarian. We also have an MSN writing tutor that will provide professional writing support. And we also have clinical coordinators. So specifically if you're going into the FMP, for an example, if you're going into the FMP program, our clinical coordinators find clinical placements for the students for all clinical courses.
Great, thank you. And then what strengths do you think that you and other faculty members in the program possess to help students reach their full potential?
Absolutely. So one of the greatest aspects at Saginaw Valley is all of our faculty teaching the courses are experts in that content area. So that is one great aspect about the way we plan out our courses. Also, when we're looking at graduate field studies, the MSN field studies or doctorate change projects that they complete, they're also paired with a chairperson to provide them guidance that has expertise in that area as well.
Awesome, thank you. For our MSN students, specifically, if they're successful in the program, do you continue, or do you recommend that they continue going on for a PhD or continued education?
Great question. So it truly depends on what the student's aspirations are. Absolutely, if they want to continue on. At Saginaw Valley, we do offer a doctorate degree. It's a DNP, a Doctorate of Nursing Practice. This is different than a PhD. So a Doctorate of Nursing Practice is a practice-focused degree. So it depends on what the student is going into and what their ultimate goal is for their education.
Awesome. And then for our DNP students, if they're successful in the program, do you recommend that they do any continued education?
Great question. So with the DNP degree, your role in your healthcare team doesn't necessarily change. So with the DNP degree, it's practice focused. So what we are preparing our graduates is to complete system changes and quality improvement projects to ultimately improve patient care and patient outcomes, including systems outcomes as well.
Awesome. Thank you. So one of the last, almost the last question that came up is, what employment opportunities do you see students getting either after graduation or still while they're studying?
Great question. So this is going to depend on what program of study the students have completed. So in our family nurse practitioner program, we are preparing graduates to practice in a family practice setting. In our MSN of education, there's multiple opportunities out there, whether it's at a college or working in a hospital setting. There are multiple different areas that they can go into. Administration can be in an inpatient or an outpatient setting with our MSN in administration. We also have an MSN clinical nurse leader, so that is very specific to the organization as well. And then, like I mentioned previously with the DNP, your role might not change as it's a degree, but the opportunities you have in that organization to create change.
Thank you. And then my final question is, as a program coordinator, what is the best way for a student to contact you?
Great question. So the best way right now is through email. So my email, cmhupert@svsu.edu. You can also contact me by phone as well, 989-964-4595.
Great.